Hello everyone. Today I'll be discussing fentanyl, one of the most dangerous and rapidly growing substance abuse crises in our society. This presentation will cover its background, epidemiology, risk factors, clinical features, and approaches to care. Fentanyl is a powerful synthetic opioid originally developed for legitimate medical use, especially for severe or chronic pain. However, illicitly manufactured fentanyl has become a major driver of the opioid epidemic due to its extreme potency and frequent contamination of other drugs. Fentanyl began as a medical breakthrough but became a public health catastrophe. It was synthesized in 1960 by Dr. Paul Janssen and in 1968 became used medically. Transdermal fentanyl patches became increasingly popular for use in the 1990s, and by 2010, illicit production surged, mainly from labs overseas, and then fentanyl began appearing in the street drug supplies, often without users knowing it. Currently, the opioid crisis continues to escalate with a rise in overdose mortality due to fentanyl additives and polysubstance-related deaths. Fentanyl-related deaths now exceed those caused by car accidents and firearms. What's alarming is that even a tiny amount, just 2 milligrams, can be lethal. Fentanyl's presence in counterfeit pills has dramatically widened its impact beyond traditional opioid users and is now the leading cause of death in adults between 18 and 45 years old. According to the CDC, over 80,000 opioid overdoses in 2023 were from synthetic opioids, with the highest rates seen in the Northeast, Midwest, and the South. Certain groups are at higher risk, especially those with pre-existing pain conditions, past opioid prescriptions, or limited access to behavioral health care. Additionally, youth experimenting with drugs are at high risk because of counterfeit pills laced with fentanyl. And interestingly, veterans and individuals who have been through trauma are also at increased risk for opioid use. The short-term effects of fentanyl produce rapid euphoria, which contributes to its addictive potential. It also depresses the respiratory system almost immediately, making overdose a high risk, especially when combined with other depressants like alcohol or benzodiazepines. Other short-term effects: pinpoint pupils, confusion, dizziness, and nausea. Long-term effects: chronic fentanyl use leads to profound dependence. Users may need increasingly higher doses to achieve the same effect, which leads to a vicious cycle of addiction. Additionally, individuals are at increased risk of infectious diseases like HIV and hepatitis C. Long-term use also damages multiple organ systems and increases psychiatric comorbidities. When assessing patients, these signs may indicate fentanyl abuse. Nurses and providers should also recognize behavioral signs such as secrecy, frequent ER visits for pain medications, or unexplained lethargy. Signs and symptoms include pinpoint pupils, changes in mood and irritability, slurred speech or poor coordination, drowsiness or nodding off, changes in their appearance when they get neglecting their personal hygiene, track marks or injection sites, mood changes or withdrawal symptoms, and even paraphernalia, patches, foils, powders, and counterfeit pills. Overdose potential and suicide risk. Fentanyl has an extremely high overdose potential. As little as 2 milligrams can be fatal, as it depresses the respiratory system rapidly. Because of its potency, fentanyl is a leading agent in both accidental and intentional overdoses. The onset is so rapid that individuals often collapse before help can arrive. Naloxone is the key life-saving intervention, but it has to be administered quickly. To put into perspective on how small a lethal dose can be, a milligram is approximately the size of one tiny grain of salt, and most of the drug sellers or manufacturers often have no clinical or chemistry knowledge. When they are adding fentanyl to other forms, they put way too much into them, sometimes even unknowingly. Currently, there is a growing concern in intentional overdoses and suicide attempts using fentanyl. Examples of a nursing care plan. The nursing care plan focuses on stabilizing the patient medically, addressing withdrawal symptoms safely, and initiating long-term support systems to prevent relapse. So goals are to achieve and maintain abstinence, restore physiological stability, and develop relapse prevention plans. Some interventions we would want to do include monitoring vital signs, mental status, and withdrawal symptoms, administer medications such as naloxone or medicines for symptom management, provide education, and then even motivational interviewing is a technique to be used. Medication-assisted treatment, or MAT, is the gold standard of treatment for opioid use disorder. Naloxone is used as a reversal agent for acute opioid toxicity. Suboxone, which is buprenorphine and naloxone combined, is used for long-term daily management for cravings and to keep the individual out of withdrawal. Clonidine is also commonly used to manage withdrawal symptoms. These medications stabilize neurochemical imbalances caused by chronic opioid use, allowing patients to engage in therapy and recover safely. However, to effectively treat opioid dependence and substance use disorder, the individual will have a better chance of sustaining sobriety and recovery when utilizing medications such as Suboxone in combination with counseling, either weekly or monthly. They have the best chance of sustaining abstinence with medication and counseling combined. Therapy and psychosocial support are essential for long-term recovery. Cognitive behavioral therapy helps individuals identify triggers, while contingency management reinforces abstinence with positive rewards. Peer support and mindfulness and stress management techniques also help with long-term recovery. Nurses play a major role in patient education. Teaching about overdose signs and naloxone use can save lives. Patients should also know the dangers of street drugs and counterfeit medications. Another significant teaching point is the safe use and storage of prescription opioids. Once they're finished with them, if they didn't take the whole prescription, how can they get rid of them appropriately? And then importance to the treatment plan, making sure that they know that they have to adhere to that treatment plan. Effective recovery requires a multidisciplinary approach. involving addiction counselors, social workers, and medical providers. Continuous follow-up is critical for maintaining sobriety. So we would want to do referrals to addiction specialists or rehab centers, connect with social services and support groups, ongoing monitoring for relapse or co-occurring disorders, regular follow-up appointments for MAT, and then weekly or monthly counseling. Fentanyl is the driving current opioid overdose epidemic. Its potency and prevalence make it one of the greatest public health challenges of our time. As nurses and healthcare professionals, we have the power to intervene through education, early detection, and compassionate care. And then these are the reference slides. And that was the end of the presentation.